Next up, we have the amazing Abbey Hauser, who was our keynote speaker earlier this week. Abbey has had incredible advocacy impact to date. She is the board of directors for the EveryLife Foundation for Rare Disease, and she's also on the Team 200 board of directors. She's involved with she's met the Capitol Hill and other lawmakers to discuss rare disease policies, and today she will be sharing about the importance of policy to the rare disease space and how this can be applied to our TBD community. So, welcome, Abbey.
Thank you. As Kelly said, I'm Abbey. I've met probably all of you by now, but today I'm talking to you about policy, and I know that the word sounds terrible, it sounds scary, and it sounds very politically heavy. But I come to you as someone who studied kinesiology for college. So my degree is in exercise science, which is not policy. So if I can do it, I really have faith in all of us being able to do it, and that's where today's talk kind of comes in handy in figuring out where you as a patient, caregiver, family member, or just someone related to the organization can participate in policy advocacy as you see fit. Now, when I'm not up here telling a story like I was for the keynote, I like to tell you where I'm headed. So I'm going to tell you a little bit about my background, the types of advocacy that exist, why does policy matter, how you can use your voice to make an impact, and then how you can maybe jump in and get started. We have a few opportunities that might come up in the coming months here if you would like to get interested. So a little bit about my background. This slide got a little bit funky, but I was diagnosed in 2001 with my rare disease. Then I kind of took an advocacy backseat and didn't do a lot with my diagnosis growing up. But then in 2017, my senior year of college, I started a blog and started storytelling, and I named it Owning My Story. And from there, I somehow got connected with someone in the state of Minnesota who was working on a rare disease advisory council bill and said that I would be a great fit to speak at our state capitol on Rare Disease Day. And then I testified for a few State House committee meetings, and I had no idea what I was doing. But this person just believed in me, and they said advocacy is just telling your story and connecting it to policy. And from there, I hit the ground running. And in 2020, I moved states, so I left the state of Minnesota and decided federal policy was how I could continue making an impact from whatever state I was in. So I joined the EveryLife Foundation, and they have a specific young adult program for people 18 to 30 called the Young Adult Rare Representatives, and they do a leadership academy, they do meetups, they specifically connect you with people that will train you on how to speak and how to engage in policy. And they also do it for adults as well, but I joined through the young adult side. And then throughout the pandemic, I met virtually with my lawmakers, my senators, my representatives. I think I've met with them like 6 times virtually now. And then in June, I was invited to join the board of directors of the EveryLife Foundation to continue spreading this young adult policy voice. And then just this past February, along with Kelly, I was in Washington, D.C., meeting with all of our lawmakers in person to advocate for the bills that we find important to our community. And that is me with my state senator, Amy Klobuchar, who is one of a really big champion in our country for rare diseases, and who we can keep using as a partner to get things done. Now, we don't talk about this a lot, but there are technically 3 different types of advocacy. There's self-advocacy, which is what we all do. It's essentially just speaking up for yourself. It's how you advocate at the doctor's office. It's just you advocating for your own needs. It's just kind of a one-to-one advocacy. And then there's something called individual advocacy, which gets a little complicated because it sounds just like self, because to me, self and individual sound like the same word. But they are different. It's essentially when you get small groups of people to advocate for one thing. So it might be you gathering your friends to advocate for a better playground in your community. It's a small thing that you're doing for one person. And you can do that informally, just with friends and family, or you can get an organization to do it. A lot of nonprofits end up advocating in this way as well. And then there's the thing that I will be talking about, which is systems policy advocacy, which is where we're looking to change policies and laws. And this can be at any level. It can be your county, your federal, your state, you name it, and you can advocate for it. the biggest thing that I always get asked is, why does policy advocacy even matter? Where does the patient voice fit in? Why are the lawmakers not the ones just knowing what to do? And there's a lot of reasons that we should advocate. And one of the reasons is it acts as a blueprint. So policy is what dictates almost everything that we do, especially in the rare disease space. If a drug is being developed, a policy has been created to create that pathway. Healthcare, health insurance, any research, all of that is dictated by policy. And wherever a policy is implemented, there's an opportunity for a patient voice to be added to the conversation. And advocacy matters because we get to use our voices. Policy sounds scary. It sounds like politics, like I've said, and people do not like getting political. But rare disease policy is very bipartisan. Most of the things we do not take a party line. We are just trying to make better policies that impact rare disease lives and that save lives in the end. But if our voices are not in the room, people that have no idea what's going on will be the ones making the decisions. So we need to be there, sharing our stories and connecting that to important policy so that what we want gets done, gets done. And like I said, it lays the groundwork. So policies move so slow. I don't know if you've ever followed a bill through introduction to completion. Sometimes it takes 3 years, 4 years. Sometimes it gets introduced and then it goes nowhere, and you're like, what is even happening? But the more that we engage and we get these policies going, we are laying the groundwork for the future. So even if it's not going to impact you directly in the next month, week, year, it will make an impact further down the line, and that's why we still need to keep advocating with it. And especially in policy, using our voices as patients is one of the most strategic moves that we can do. Because congressional staff are young. A lot of times when you meet with your lawmakers or meeting with their staffers, they're young, they listen to lobbyists all day, they sit and they are bored. But when we show up with patient voices, we show up with our stories, and we show up with the human side of what we want, and we're able to connect our stories to a policy that we want them to work on, they're going to remember that, and that's going to be a bill that they're going to be more focused on actually getting done, because we've showed up and we've given that human side to it, and we're not just a paid lobbyist that is showing up and speaking about oil prices or whatever other politics are. And the last thing is anyone can do it. Anyone at any age at my organization, we have people show up as young as 6 to our meetings. And I think we had someone that was 90 years old that was showing up. So anyone can do this. There are organizations that exist to train you in doing all of this. Like I said, studied exercise science. I don't know anything about policy. Everything that I have learned has been taught to me through an organization, through a webinar, through education sessions. It's been nothing that I've gone and done extra research on my own. I'm just committed to attending the services that are already out there in the world. So you don't have to reinvent the wheel when it comes to advocacy. There are places that will help you find that voice. And I always put this in, a little secret is, I meet with my lawmakers, my representatives, my senators all the time. I cannot tell you how a bill becomes a law. I can tell you that a lot of steps happen. I can tell you that it goes to committee. Something else happens, someone does something else. Eventually it gets signed into law. But you don't need to know all those steps. We let other people that went to school for that know those steps. But my voice and your voices are effective because we learn where it's best utilized and when to defer to the policy experts. I'm not going to speak to things that I don't know about, but I know my story and I know how it connects to these bills. And when I speak on that, that is more powerful than me trying to figure out how government works. So you don't have to know everything to get started. All you really have to do is show up and be willing to share that story. And here, using your voice is extra important because I know I was just talking with someone, I think on day one, it might have been you, Troy, we were talking about family leave or time off after a bone marrow donation or stem cell donation and protecting those things. And actually just last month, Representative Dean Phillips in Minnesota introduced a bill that is called the Life-Saving Leave Act, and that is working to extend the Family and Medical Leave Act of 1993 that protects donor time off for solid organ donation. And right now we're working to permit additional leave for bone marrow or blood stem cell donation time off for the donors on that side. So there are policies all around with what we're doing that impact, whether it doesn't have to be directly drug development. There are things in your community that you can find that your story connects to, because if you relate to the stem cell donation or the bone marrow donor or things like that, your story can have an impact on that because you know how important that is to your life and you know how important it is to protect that leave. So all of a sudden you have a story and you have power to lend to this piece of policy right there without even knowing more about the act. Your voices will already make an impact there. And as Katie and I were just talking about earlier, the FDA is another place that patients have power. And when we say the FDA, I know that gets really complicated and confusing, and a lot of people don't understand how it works, but there's this whole movement in the rare disease space called patient-focused drug development. And that is the growing use of patient experience data in clinical trials. And a lot of these things happen at the FDA, and we're working on a few bills that are going to hopefully require clinical trials to just report how they've used patient experience data, which is just using real life, real voices that you've had patients share their stories within your trial and how you're using that to further your drug development. And at the FDA, there are pathways that our researchers rely on. There's accelerated approval, there's the Orphan Drug Act, and there's so many things that are currently right now in our political landscape that are a little bit at risk of hampering some rare disease drug development efforts. There's some issues with drug repurposing and some roadblocks that are being created just through the ramifications of other bills that have gone through. And we have the chance to use our voices in these scenarios to make that difference, because when we speak up to these issues, we are helping our researchers. We might not be able to participate in every clinical trial. We might not be able to fundraise to fund all these grants for the research, but we can protect the efforts that will go into getting that drug eventually approved. There's policies in place that will let that happen, and the more that we lend our voices to using this, the better off that we have just throughout the entire landscape of rare disease to continue making this difference. And if we aren't there in that room, the decisions and policies are going to be made by people that have no idea what's happening. They're going to be going based on what they think the community needs. They might be going on what makes the most financial sense. They don't know unless we tell them, so we have to continue showing up in these rooms, or sending people that are related to us, sending friends and family, training them if you don't have the capacity, telling anyone that they can get involved. If they know you with a rare disease, they can get involved in this advocacy. It doesn't have to be just us, the patients, doing all of it. And a recent example of the patient voice sort of winning is there was a big push for Medicare and Medicaid to cover power seat elevation in motorized wheelchairs, which, if you're not familiar with that, is just in a power wheelchair, a lot of the chairs stay at ground level. But a recent technology was developed that allows the chairs to lift so you can go to eye level and make eye contact with people, which has huge psychosocial benefits. But it also allows you, like in this photo, it allows you to reach things in your house a lot better. However, Medicare was denying this access because they said it was a luxury item and it was not a necessity. So the patient voices between the spinal cord injury community and the neuromuscular disease community, they got together and they submitted patient voices, they submitted comments to CMS and Medicare, the people that are making that decision, and they went hard on this. They got so many stories collected, they really engaged their communities to get this happen, and Medicare listened. Now power seat elevation is now included in coverage for Medicare and Medicaid, which is something that would not have happened without that patient voice, because on paper it seems like a luxury. But when you get someone in there telling a story about the difference that it's made to look someone in the eye again for the first time after spinal cord injury, that makes all the difference, as opposed to just seeing the cost on paper that it's $10,000 more added to the chair. That's all Medicare was seeing before. They weren't seeing the patient side, but these voices made that difference, and that is what changed their minds. So there's many ways that you can get started. If you want to go what I consider the challenging path, is you can just get started on your own, find a bill that you feel passionate about, and contact your local lawmaker and have fun with that. But I recommend you join an organization. I will say I'm on the board of directors for the EveryLife Foundation for Rare Diseases, so I'm a little bit biased, but we do a lot of advocacy tools and getting people involved in training you to connect with these policies. So we have all the meetings, they schedule the meetings with lawmakers, they give you the training, they give you the webinars, they present you with policies that they've decided might be beneficial to the community, but you're also welcome in any of our meetings to bring up any bill that you want. We do not, at the EveryLife Foundation, we always say we do not speak for the patients, we just train the patients to speak for themselves. So that's what you can do if you join an organization that way.
I just want to say I'm a mentor at the EveryLife Foundation, so if anybody is interested, me as a mentor as well.
Yes. Katie would be a great mentor, so connect with her. Yes, no, you're going to be great. 100%. So there's organizations out there, you can find other rare disease organizations that might be doing a policy that's important to you. I know different groups, depending on like disease organizations, might have different policies that kind of pop up. But a good organization should train you and provide the opportunities without you having to go do a lot of extra homework on your own time. Because we don't have time for that. I want to learn everything that I need in a 1 hour webinar. I don't want to have to go do homework afterwards. So a good organization should lend you and guide you through that path. And if you so happen to be interested, August 7th to the 18th, just this summer in a couple months, we have an event called Rare Across America, which is sort of our sub-branch of Rare Disease Week. And that's where you meet with your members of Congress, which is your senator and your representatives. But we meet with them locally in August. So we meet with them when they're back at home at their offices for their home recess. And the Senate meetings are virtual, and your House meetings take place at your State House building. And we schedule all of those for you with the EveryLife Foundation. If you just Google Rare Across America, you can register for free. And you just select the dates that you want, and then we submit it to a company who schedules all the meetings, and then you'll get your meeting that will happen sometime between the 7th and 18th, and you'll meet with other people in your state at the same time. And you can choose just the virtual or the in-person option, doesn't matter. But it's a really great way to get started if you happen to be interested already. But like I said, policy advocacy is a little bit higher level, so if you're still in that just self-advocacy is all you can manage, that's okay. You can send other people to do policy advocacy, and if you can't, I'm there doing the policy for you. So if you feel overwhelmed just in yourself, I've got you covered. But there's always places to get that voice involved, but I don't want anyone to feel like you're not doing enough if you don't jump into this policy side as well. So do not worry. And that is it. Does anyone have any